kañ nga gëj a dem lopitaan pour nemmeeku sa wér-gu-yaram
ndax xam nga sa wér-gu-yaram fu mu toll
est-ce que yaa ngi bàyyi xel si li ngay lekka
wala exercise bokk na si li ngay sóoraale si sa dundu pour am ci lu la leer toppaleen ñu leen di bu ne si suñ programme yi health check nga xam ne lépp lu ñuy waxtaanee dina méngoo ak sa wér-gu-yaram.
I am Dr. HASSAN AZADEH. I am the clinical director of MEDICARE Health Services and also university professor in obstetric and gynecology at the University of the Gambia. October, this is the month every year that worldwide there are awareness about the breast cancer. And Gambia is not an exception. So here in the Gambia, every year, we also taking part and contribute to give awareness to about the breast cancer. What is the definition of the breast cancer? The definition of breast cancer is that the cell in the breast, they start getting swollen, they start giving changes, and they're developing kind of a lump in the breast. And those kind of cells, they are not a normal cells, they are abnormal cells. And they can increase and expand. And there is uncontrollable, those kind of the cells in the breast. Obviously, if those lump has not been recognized, has not been diagnosed, it can continue growing and it can develop in such a condition that it spread in all the women's body and eventually create the death of the woman. But there are ways to prevent this breast cancer. And today I'm here to give you some information, some advice about this topic of the breast cancer. Let's go back to the very young girls, very young female. The breast of the female, they have some changes during the life of the female. Let's start with when a young girl is about age of 9 to 14 to 15 years of age. This is the time we call them puberty. During the puberty, there are certain important changes physically, mentally, psychologically, socially, including the growing of the breast of the female during that time. During that time, when the breasts start developing, expanding, they're creating some tenderness in both breasts, and also sometimes become kind of very painful, so they need some treatment to reduce the pain in the breast. This is the first phase of the changing, of the development of the breast, female breast. The second phase is when the woman just has delivered the baby and she starts breastfeeding. That condition of the breast is enlarged and the breast has several lumps which are, we call it breast glands, which they are full of milk, prepared for the baby to be used. Those kind of lump in the breast, immediately after the delivery of the baby, they are naturally. So we cannot call them as any abnormal lumps. The third phase of the changing of the women's breast is when the women reaching menopause. Menopause is the time of the woman when the menstrual period stops. We're talking about the age of 45 above, up to 55. During the time, there are some other changes in the woman, in the female. And those changes are that overall having again changes of mentally, psychologically, and socially, and also affected the breast as well. The breast, the shrinking, and due to lack of vital hormone, we call it estrogen, and also the lack of blood circulation in the entire female's body, including through the breast. So breast tissues do not give enough oxygen and enough food, as we call it, to stay the same condition and stay normal. Statistically, during this time, the incidence of breast cancer are quite high during the menopause of the women. You might ask me, what are the causes of breast cancer? The answer to that is very common are the changes in female hormones. By changing of female hormones, eventually they can also affect the function, healthy cell of the breast, and eventually developing a breast lump. To say that not every breast lump is a cancer. There are some benign, there are some non-cancer lumps in the breast, which also needs to be investigated, diagnosed, and be treated. The other cause of the breast cancer is inherited from the grandmother, mother, and transferred into the daughter. So breast cancer is inheritable. It can be in the family, and it comes. There are few other causes for breast cancer which I would like to mention. Those ones are rather avoidable. The obesity of the overweight of the women with obesity, they have a chance eventually, because of changing of the female's hormone, to end up developing breast cancer. So that could be avoided. That's why I mentioned it's avoidable. So you have to try, keep your health, keep your weight, and not become overweight, because overweight is not only harming, eventually developing the breast cancer, they can develop in several human organs different changes and also developing cancer. Now, other causes for breast cancer, also they are avoidable, is the lifestyle of the woman. Women who excessively drinking alcohol, women excessively smoking, women taking drugs, those things, when it's been those toxic, it comes to the woman's entire organs, in particular. So those women with such a lifestyle, which I call it bad lifestyle, they will also end up, and they have a chance to develop breast cancer. And there's also causes is like radiation, the pollution, and thank God we don't have those in the Gambia. And also thank God we don't have women drinking and smoking, so that eventually those kind are more for the Western countries. And in fact, in Western countries, the incidence of breast cancer is higher than in Africa. Now, you might ask me, how would I know that I have a lump in my breast? The answer is very easy. The answer is, if you start examine your breast yourself, we call it as a self-breast examination. It means while you're taking a bath, while you're taking a shower, at least three times a week, you try to touch your breast. You start to touching the nipple, whether the nipple has got is mobile, whether the nipple has got any lump behind it, and you continue touching above the nipples, beyond the nipple, and also at the side of nipples, so that usually the breast tissues are quite soft tissues. But if you come across any part of the breast, of any breast, areas which they have got a bit of hard tissues, that is the time you should suspect, I think I have to go and get my breast checked. I give you a quite interesting statistic. About 86% of women, they diagnose the breast lump themselves, not the doctors. Once they have this exercise, simple exercise, and once they suspect anything in any of the breast, that is the time they come to the clinic and they get investigated. And the investigation or the diagnosis of the breast lumps, there are facilities like a scanning machine, X-rays, and thank God for that. In the Gambia, we have these facilities available. We're starting with a government hospital and clinic, private clinic, NGOs clinic, and there are some experts who we call radiologists. They do scan the breast. Once they do scan the breast, and they find out whether they are normal or abnormal tissues. So this is something you should be aware of it. This is something we recommend for you to start from today, at least 3 times a week, to do a self-breast examination. If you feel or see any abnormalities, it's better to go and see a clinic, see a doctor for you to be diagnosed. And if the breast, if you don't do that, if you come too late, you are harming yourself. You will end up to die unnecessarily of a breast cancer. Because any abnormalities in the human body, if it's been recognized early, it's been diagnosed early, there is always a different type of treatment available, whether this is medical, surgical. That could eventually help you if you have developed a lump, and which is eventually it's been diagnosed as abnormality. The doctor will take kind of sampling from that growth and give it to another department, we call the pathology department. Those experts taking and looking through the microscope about the cell we have given to them, whether they are normal or they are abnormal. And they will report about that. Once even the reported, no, they are normal cell, it doesn't mean that it's forever. in Western world, every woman, when they come to age of 40, 45 years of age, at least they go for kind of scanning, breast diagnosis every 2 years. So once it is normal, you still need to continue at least every 2 years, go for a checkup and to see whether there is anything has developed. If not, then you are very lucky. Now, if you, furthermore, if you that you feel a lump, a growth inside, they could be very close to the skin of the breast, then you feel that it's hot, is warm, is red, is painful, very sensitive. If it comes to that, there is definitely, is suspected for you to have a breast abnormalities. And you need definitely go for it. Unfortunately, we see quite a number of the patients in the Gambia admitted at the Banjul hospital with a very, very late advanced cancer. When any cancer become advanced, become too late, there is hardly anything we can do about it. They become not curable, they are incurable. So therefore, advice is that you start from today. The advice we are sharing with you, and we give it to you, that you make use of it, and make sure that you are aware of the condition of your breast all along. Now, in the Gambia, now we do a bit more about that. The clinic, medical clinic, now get a step further. The medical clinic, they give you, for the whole of the October, a free consultation and examination for every woman. And also, if by examination and then consultation, they is suspected of any breast cancer, of any breast abnormalities, then you might need scanning. A radiologist, a specialist, also can do a scan on your breast. Just to make it affordable, the clinic give you 80% discount for you to able to go for this kind of investigation and diagnosis. So, conclusion of what we're discussing today is about breast awareness about the breast cancer, about the definition of breast cancer, about the causes of breast cancer, about the investigation of breast cancer, and about the treatment about cancer. So actually, that is what we have to say today. And there is a telephone number for the medical clinic. The women, they can call and they can get appointment. And we are looking forward to see as many female in the Gambia as possible to come for this offer, what we have prepared for you at MEDICARE, for you to be aware of it and make use out of it. And obviously, the good health is a good life. Thank you.